In the past week, members of the jury have been hearing evidence in relation to the fatal collapse of child C at a neonatal unit in the Countess of Chester Hospital. It is expected that today the case will turn to the fatal collapse of child D in June 2015. The prosecution say that Lucy Letby, as in the case of child A, B and C, administered a fatal air injection. The defence deny this. During the prosecution opening statement, the jury has heard child D, a baby girl, died following 3 collapses in the early hours of June 22, 2015. As has been the case for the other children in the case so far, the court will hear evidence of the circumstances which happened in the days leading up to child D's collapse. As ever, the case is being heard in Manchester Crown Court in front of a jury of 8 women and 4 men, and the trial is expected to last 6 months. This is the 4th week of the trial being heard before a jury. Child D's mother is now being called to give evidence, a reminder that the family members of any children involved in the case cannot be identified due to reporting restrictions. The prosecution, led by Nicholas Johnson KC, asks Child D's mother to confirm details. Child D's mother tells the court she developed a concern about her waters breaking, which the court hears was, quote, well-founded as her waters broke when she woke up on June 18th. The hospital told her to, quote, monitor the situation. She waited and rang the hospital again and was then told to go to hospital. At 11:30 am, she arrived at hospital and staff confirmed her waters had broken but did not test. They then checked her and her baby, quote, not for very long. Were you, in effect, sent home after being examined? She replied, yes. The following day, the mother returned to the hospital and saw a midwife. Were you examined and various checks performed on you? She replied, yes, not straight away, I had to wait. Did you express concern to the staff at the Countess? The mum said her waters had broken over 24 hours before. She didn't, quote, feel right, and the baby didn't seem to move as well, and she was concerned about infection as she hadn't been given any antibiotics. The decision was then taken to induce. She said staff were, quote, very busy, and she was placed on an IV, but not for, quote, many hours. It was, quote, very delayed, the mother tells the court. The mother said she was very worried and scared, unwell and not in control, and forgotten by the staff, as it was nearly 48 hours after her waters had broken. On a trip to the bathroom, she noted blood had come out. She asked someone to do something. She said she remembered seeing a doctor and recalled giving a description of her. It was the first time she had seen a doctor since her admission. She was told that essentially both her and her baby girl were okay, and that a natural birth would be considered, and that it would be reviewed 4 hours later at 11 am. At 11 am, the mother was assessed again by a different doctor. She was told there had been little progress, and she said he was the first professional who spoke to me and addressed my concerns. The mother said it had been about 50 hours since the waters had broken, and a C-section was considered as there had been no dilation. The mother was informed a natural birth would be the preferred option to a C-section. By 3 p.m, the mother had discussed the situation with her husband and concluded she would be, quote, less patient and called for a C-section if there had been no progress. At 3 p.m, the mother was reviewed by the same male doctor, and he was, quote, more concerned about the situation as she appeared more tense. The doctor then confirmed she would receive a C-section as he said it was, quote, not a good idea to wait any longer as the baby appeared distressed. Events then moved on, quote, a lot more quickly after staff had initially appeared chilled. After the C-section decision was made, matters moved a lot more quickly. Child D was delivered and lifted over the screen for the mother to see. The mother recalls seeing, quote, no life, lifeless, she did not scream, everything was quiet in the room. Mr. Johnson asks if there was a nurse in the theatre room at this stage. The mother does not recall. The mother was taken to a ward while medical professionals dealt with Child D. The mother recalls seeing Child D very briefly in the operating theatre before they, the staff, took her away as they had concerns. The mother said she was, quote, very aware of things going on, despite having received anaesthetic. She did not have physical contact with Child D, but her husband did. The mother was taken to a ward. The mother was taken to a further room, and it was there where she had physical contact with child D. Her impression of child D's condition at that point was, quote, really worried as she was brought to my chest, but she didn't have any movement. She looked limp and pale, struggled to breathe and was making a groaning noise. She wasn't really responsive. There was a split second where she opened her eyes and looked at me, but then no response. I tried to breastfeed her, but she was completely limp, so I was worried. A male paediatrician informed the mother, quote, not to worry, as the delivery had been through C-section, so the breathing wasn't as clear. The mother said she didn't believe what he said. His attitude seemed, quote, too careless. The mother said she thought something was wrong with child D, and one of the midwives would assess her in a couple of hours. She said she did not want to wait that long and wanted another doctor's opinion. The same doctor came back, but he had spoken to a consultant. The mother said she was, quote, not reassured, but was glad someone took me more seriously. She was then worried as child D was taken straight to neonatal unit intensive care. The mother said she felt, quote, rubbish, drained, and didn't feel any relief. She was in pain and knackered. The mother said it was around 7 to 8 p.m. when she was separated from child D. The following day was Father's Day. The mother was given the news that child D had been, quote, up and down all night, struggling with feeding, and staff didn't seem too concerned then, but child D wasn't great. The mother believed she had been spoken to by a female consultant doctor that morning. The mother said she recalled child D needed to be on a CPAP machine, and every time they tried to take her off, she would crash. She said staff did not seem overly concerned as child D was a good-sized baby and making progress, despite being, quote, poorly. Other tests showed she seemed fine. The mother said she was able to see child D at about 7 p.m. that day. The mother said she had spoken to a doctor before heading to the neonatal unit. A drawing that the mother had made showing a plan of the neonatal unit room is shown to the court, showing the positioning of child D's cot, other cots and crosses identifying a number of medical machinery. Child D's mother said she had spoken to Dr. Andrew Brunton at 9 to 9:30 p.m. and was told he was, quote, very happy with child D's test results. They had done more scans and she was well, and promised her she would be able to hold and cuddle her the following day. The mother said she was not in a good condition herself, being moved in a wheelchair and 10 out of 10 in pain, but was happy with child D. Child D looked like, quote, a good pink baby, tiny but chubby and looked healthy. The next time she saw Dr. Brunton was the following night. She and her husband were woken up at about 4 a.m. by a nurse to come quickly as child D was poorly. They rushed downstairs and Dr. Brunton was holding her and trying really hard to resuscitate her. We were just standing there looking at child D dying. The doctor was, quote, quite agitated and the couple heard they had to let child D go. The mother said she could not stay there anymore and asked to be taken away. A nurse, who the mother believed to be Lucy Letby, was holding a phone to Dr. Brunton's ear, she recalled. The mother said she had seen Lucy Letby before when she went to see child D in a neonatal unit at around 7 p.m. The mother recalls as she was wheeled into the room, Lucy Letby was, quote, hovering around, not doing much with child D. She had a clipboard and was looking at the machinery. Quote, I didn't understand what she was doing. And the mother asked if child D was fine, to which Lucy Letby said she was. Lucy Letby, quote, just stuck around and was just watching, looking over us. The mother said she asked Lucy Letby to, quote, just go away and leave us in privacy. Mr. Johnson asks if Lucy Letby was in the neonatal unit room at the time child D died. The mother agrees and says other doctors were in that room. The mother says she did not stay in that room. The mother recalls she was taken to a private room where child D was, along with her husband and another family member, and a nurse she had not seen before. The mother said she did not see Lucy Letby again. Ben Myers, KC for the defence, is now asking the mother questions. Mr. Myers says it is an awful experience what the mother went through, and says he has 1 or 2 questions to ask. He asks about the 7 p.m. neonatal unit visit on June 21st. The mother said she went there with her husband. She recalls 7 p.m. as she, quote, must have looked at the clock. She said there was an exchange of few words between her and Lucy Letby. Mr. Myers asked if that was possibly another nurse. The mother replies, quote, I don't think so. The judge, Mr. Justice Goss, asks for clarification. The mother said she would not have known the name of Lucy Letby at the time, but would after seeing her picture after she had been arrested. The court is now hearing an agreed evidence statement from the father of Child D. The court hears from the statement Child D died at 4:25 a.m. on Monday, June the 22nd. He said he does not remember any specific problems from the mother's pregnancy, but had, quote, immediate concerns when she was born as she appeared grey and was not crying. Quote, initially we were reassured by the staff, and he said he believed them and never thought Child D would die in the circumstances she did. The father recalls the circumstances leading up to the birth as recalled by the mother. He recalled the mother did not respond to inducement measures and had mild contractions between 2 and 3 a.m. on June the 20th, but had not dilated. She was, quote, encouraged to wait for inducement methods, but she did not want to as she had been in labour for some time. They were told medical staff were, quote, monitoring the situation and were told antibiotics were not necessary at this stage. They said they agreed on a C-section, and at about 4 p.m, the mother went for an emergency C-section. Child D was held above the sheet momentarily and wrapped up and taken to the scales. Quote, we weren't informed of any issues. I was led to believe everything was okay. He said Child D was very quiet, which was unexpected, and held her in his arms. He said he was not sure if Child D was given any breathing support at this stage. He went back to the ward with Child D for a brief time, and he and the mother put pyjamas on her. However, quote, she didn't seem interested in feeding at all. They said they were told Child D was doing well. Quote, we repeatedly asked if she was okay. We just weren't comfortable with how she was. Medical staff kept telling her Child D was okay. A few hours later, a different paediatrician came and Child D was taken to the neonatal unit. The parents were later told Child D was not well. Quote, it was a bit of a shock when the father saw Child D in a neonatal unit as she was, quote, very poorly, wasn't feeding and had lots of tubes in her mouth. Nursing staff, quote, always made the father feel welcome when he arrived. On June 21st, the father went to see Child D and was, quote, almost certain he saw she had been taken off CPAP. He said he frequently visited the neonatal unit and asked staff. Quote, it was Father's Day and I was given a handmade Father's Day card. The staff had put it together and it had a message from Child D with a photo stuck inside. On the first photo, she has CPAP. I took that with me. Quote, later that day, I was given a welcome card and a photo which showed her looking better and not on CPAP. In the early hours of June 22nd, he was woken by a nurse to go to the neonatal unit as Child D was poorly and they were taken there quickly. Quote, when we walked in, we understood immediately it was very serious. Andrew, the senior doctor, seemed to be in charge. I remember someone mentioning adrenaline and there was a sense of urgency. Andrew had a phone held up to him and he was discussing the situation with someone on the other end. There seemed to be some confusion over what baby they were talking about. The person on the other end seemed to be referring to a different baby. They were unsuccessful in resuscitating Child D. They said they'd been trying to resuscitate Child D for over 20 minutes. I couldn't tell you which staff were in as I wasn't paying much attention. I didn't want to look. He added the parents weren't in the room for too long, about 5 minutes. He does not recall seeing Lucy Letby at this time. He went back to the ward and informed another family member of the news. Intelligence analyst Kate Tyndall has returned to give evidence and give a walkthrough to the jury on the evidence tiles in the electronic bundle. The first evidence shown to the court is Lucy Letby's shift patterns for June 2015. It shows which days Letby was on, quote, long day shifts and night shifts. She worked long day shifts on June 2nd, 4th, 17th, 19th, 27th and 28th. She worked night shifts on June 8th, 9th, 13th, 14th, 21st, 22nd and 23rd. Child A died on the night of June 8th, 9th, and Child B had a non-fatal collapse on June 9th, 10th. Child C died on the night of June 13th, 14th. Child D died on the night of June 21st, 22nd. The evidence shown to the court shows Child D was born at 4:01 p.m. on June 20th, weighing 3.13 kilograms, 6 pounds 14 ounces, and required breathing support at birth. The APGAR scores were 8 out of 10 at 1 minute after birth and 9 at 5 minutes. Child D was admitted to the neonatal unit at 7:30 p.m. on June 20th, quote, for respiratory support requiring ventilation. Child D was, quote, grunting and her colour was dusky, it was observed. Child D was placed on CPAP with 40% oxygen support and placed on double phototherapy. Dr. Ahmed Chowdhury noted discussing Child D with the parents, saying, quote, on moving baby to labour ward, baby become blue, dusky. SATs 47% on arrival NNU. Had bagging, SATs picked up, given antibiotics, baby put on CPAP, not explained to parents yet. Notes record the administration of antibiotics and sodium chloride to Child D. The court hears phototherapy was carried out to treat Child D's jaundice. Child D was administered with an endotracheal tube on the second attempt. The nursing notes record Child D was, quote, starting to put a few breaths in for herself now. An X-ray reading for Child D showed shadowing consistent with transient tachypnea of the newborn, TTN, a respiratory disorder. A nurse's note recorded meeting the father who had visited the neonatal unit, and it was explained to him that Child D would be on the neonatal unit for, quote, at least 48 hours, and the dad was visibly upset, so lots of reassurance was given to him. A further nursing note at 4:30 a.m. on June 21st showed Child D was making, quote, good respiratory effort and blood gas readings were good, so ventilation support was reduced. Another nursing note at 7:21 a.m. recalls the father's visit to the neonatal unit. It includes, quote, father appeared overwhelmed, so lots of reassurance given. A note from nurse Kate Bissell reads at 9 a.m. on June 21st that Child D was, quote, extubated following satisfactory blood gas. Child D was initially apneic and required stimulation via neopuff CPAP, but the breathing became more regular after a couple of minutes. Kate Bissell, in a subsequent nursing note, said a blood gas reading at 10:15 a.m. was subsequently taken and the results showed signs of respiratory acidosis, so Child D was put back on CPAP. The blood gas was repeated 2 hours later and showed further deterioration with increasing metabolic acidosis. Child D's perfusion was, quote, poor, and a doctor approved a decision to administer medication. Dr. Ahmed Chowdhury recorded a UVC and a UAC were inserted. The court is continuing to go through the sequence of events, which is up to the afternoon of Sunday, June 21st, 2015. A family communication note is made at 5:53 p.m. Quote, dad visiting most of the day, he is up to date with the plan of care, mum has visited this evening. Both parents were anxious about the levels of care provided. A nursing note at 7:15 p.m. said attempts were made to get Child D off CPAP, but breathing was still shallow off that, so CPAP resumed. Swipe data showed Lucy Letby arrived at the neonatal unit at 7:26 p.m. The handover note showed Letby was one of the nurses on duty that night, with a different nurse being the designated nurse for Child D in room 1. Letby was a designated nurse for 2 other babies in room 1. At this time, another nurse was looking after Child B in room 3 for that night. The court had previously heard Child B had suffered a non-fatal collapse earlier that month. Further observations for Child D are documented throughout that night shift until after 1 a.m. A neonatal infusion prescription chart at 1:25 a.m. for Child D is shown to the court. Lucy Letby is one of the 2 nurses to provide a signature for a saline dose prescription at that time. Child D then first collapsed at 1:30 a.m. Mr. Johnson for the prosecution asks, this is within a very short time of the document with Lucy Letby's signature on, isn't it? Kate Tyndall replies, yes. A nursing note, timestamped for 1:30 a.m. but written retrospectively, recalls, quote, call to nursery ward, Child D had desaturated to 70s, required oral suction as was bubbly and had lost colour. Discolorations to skin observed, trunk, legs, arm, chin. Notes of medication are made. At 2:40 a.m, a neonatal infusion prescription chart is recorded for a sodium chloride dose with 10% dextrose. Letby is one of the 2 nurses signing for it. The medication administration update is made on the computer at 2:44 a.m. At 3 a.m, Child D collapsed for the second time. The nursing note recorded for 3 a.m, quote, Child D crying and desaturated again to 70s, commenced on 100% O2 via CPAP and picked up well, but skin discoloured again. At 3:20 am, a further neonatal infusion prescription is made, with Lucy Letby being one of the signatories. At 3:45 am, Child D collapses for the third and final time. The nursing notes recalled the alarm went off and Child D, quote, desaturated and then became apneic. Called Letby, resuscitation efforts began but to no effect. A bleep alarm went off and doctors were called to the neonatal unit. The court is shown a number of clinical notes are made by doctors for this time. These clinical notes will be discussed further when the doctors involved in them come to court to give evidence in the coming days. They include the resuscitation efforts, administration of adrenaline doses, and the decision ultimately to discontinue CPR. Child D died at 4:25 am. A text message sent from Lucy Letby to a colleague said at 8:36 am, quote, "We had such a rubbish night. Our job is just far too sad sometimes." The colleague replied, "No, what happened?" Letby, "We lost Child D." The colleague replied, "What? But she was improving. What happened? Want to chat? I can't believe you are on again. You are having such a tough time." Letby refers to Child D being, quote, messed about a couple of times and refers to a rash that, quote, looked like overwhelming sepsis. She adds that 2 members of staff said the circumstances, quote, would be investigated. The colleague replies, quote, "Dad was very anxious all day," and adds in relation to the investigation, "What's the delay in treatment?" Letby replies, "Just overall looking into the case and reviewing what antibiotics she was on if sepsis." The colleague says Child D, quote, was behaving septic. She adds to Letby, "Oh hun, you need a break." Letby said in her response, quote, "But it's part of the job and it's hard for everyone." The colleague responds, "Yes, but you have had it all recently." Letby in her response says, "Well it's happened and that is it. Got to carry on," before referring to her planned time off. The conversation then discusses staffing arrangements and the difficulties of the job before noting an instance of a happier occasion on the unit. Letby says, quote, "How do such sick babies get through and others get to die so unexpectedly?" Her colleague in her response says, "We just don't have magic wands." The colleague refers to what Child D looked like in their care. Letby replies, quote, "I think there is an element of fate involved. There is a reason for everything." The colleague adds, quote, "It's important to remember that a death is not a failure," and says Letby is an excellent nurse. Letby in her response accepts the need to take positives from the job, but it's, quote, "just so sad to watch what families go through." Further messages are exchanged between Letby and her colleague the following evening. The colleague asks, "How you doing?" Letby replies, "I'm okay, try not to think about it. Work busy, but at least we have 6 tonight." The colleague inquires about Child D and whether anything had been said about not, quote, bringing her through sooner on Saturday. Letby replies, "I don't think so," before adding there was a theory Child D may have had meningitis. The colleague responds, quote, "I'm worried I missed something." Letby responds, "I don't think any of us did, and she, Child D, was on the right antibiotics." The colleague replies, "Yeah, just would treatment sooner have made a difference?" Letby asks her colleague if Child D had a lumbar puncture. The colleague replies she was not sure it ever got done, given that the baby girl was ill and had been on CPAP. She adds her gas reading was, quote, appalling when she first came through to the unit. Letby in her response says, "I think we did what we could." She then refers to the condition of the mother of Child D. The court hears at 9:51 p.m. on June 25th, Letby search for both the parents' names of Child D on Facebook. Towards the end of June, Letby sent a message to a colleague, quote, "Work has been awful." The colleague responds, "Oh dear, staffing probe?" Letby in her response says, "We have had 3 unexpected deaths, adding the unit is full." She adds, quote, "What I have seen has really hit me tonight." The colleague asks, "Have you worked today?" Letby replies, "No, been off since Wednesday morning and now it has all hit me." The colleague asks if Letby tries talking to a proper counsellor. Letby replies that she does not think she can. The colleague responds, "Why not?" Letby replies, "I can't talk about it now. I can't stop crying. I just need to get it out of my system." The colleague advises Letby to think carefully what to do before adding, quote, "Maybe you need to take time off." Letby replied, "Work is always my priority," adding she had not cried about the incidents until then. So that concludes day 19 in the trial of Lucy Letby. If you wish to keep up to date with all the court comings and goings and the trial process concerning Lucy Letby, please give this video a thumbs up below and subscribe to the channel. As always, many thanks for joining me for this video. I look forward to seeing you all again for the next one. Take care. Cheers.